The holidays can be a time of particular stress for patients dealing with cancer or other illnesses, and survivors as well, for a number of different reasons. I think it's a time that's stressful for an awful lot of people, and adding an illness and potentially treatment to that can be a real challenge. And maybe people don't feel celebratory, or they don't have an awful lot of energy to put towards all of those things, and that's okay. That's actually a common thing for people even who aren't sick. Not everyone feels that intense joy during the holidays, and a lot of people feel the stress of having to feel that way. It's clear that the mind and body are connected. It's clear that stress impacts our bodies. When we feel stressed, we feel it in our bodies. We feel aches and pains that we don't normally feel. We get headaches, we have trouble sleeping, we feel tired. It's a physical experience. It increases our heart rate, it increases our blood pressure, and clearly that's not good for the body. Does it progress cancer or interfere with chemotherapy? I doubt very much that it does that, but it's not a good way to feel, and it's in a patient's benefit, of course, to mediate the tensions, the physical tensions of stress, and try to allow their bodies to be as healthy and calm and clear as it can be to focus on getting well. To reduce the number of stressors or the impact of stress during the holidays, patients and survivors have a lot of tools that they can use. I think that looking at the holidays in a more realistic way this year is going to be the most helpful thing. Not all of the rituals and traditions that have ever happened may be able to happen this year, and that might be okay. For patients and caregivers to focus on what really matters, what's really important, prioritize the things that they can't let go, the rituals that must be present, the things that they need to accomplish, and maybe try to let go of the rest. There's a tremendous amount of pressure during the holidays to do so many different things, to prepare feasts, to get together with family, to attend social engagements, to send holiday cards, buy gifts, and so on and so on and so on. And patients and survivors sometimes have extremely little energy, not to mention time. Cancer treatment might be a full-time job for people, and they just don't have the time to delegate to all these different tasks. An incredibly important thing for them can be to share the responsibility. Sometimes we can feel so alone in having to do all the things that we need to do, and there are more often than not people who want to help. So perhaps there are people who can help with the Christmas shopping. There are people who can help decorate the tree. There are people who can assist with the things that a patient and caregiver really wants done, while they focus on what matters most to them. Behavioral health science has brought us a very simple tool that can help manage stress. It's very simple, but it's very powerful, and it involves breathing, as simple as that. So when you feel anxiety, stress, pressure, whatever it might be building up in your body, you feel sweating, you feel your pulse increase, you start to feel nervous or edgy, a very simple thing we can do is put your hand on your belly and slow your breathing. What we've learned is that the brain cannot focus on or even process or deal with fear, with anxiety, with stress, with rage, if the body is calm. The brain cannot be anxious if the body is calm. And so the simple task and the very powerful task is to simply slow your breathing. If you put your hand on your belly, it's a great way to focus inward and take that breathing down. It might take a couple tries, it might take some practice, but again, a very powerful tool to help moderate stress.